So hi, I'm Brian Adriana and I will be performing the suctioning. So first in the suctioning, we need to assess the patient's respiratory response. Like we need to listen on his lung sound, the wheezing, crackles, and anything that is uh, indication of the lung. And then also we need to assess the patient's contraindications, wherein the patient has the epiglottis or the laryngolitis, and also if the patient is not needed to suction in the mouth or nose or trachea, which is because of injury. So we must identify it first before the suctioning. And now after all the contraindication, we need to prepare all the materials needed. We will prepare all the materials needed, the stethoscope for the auscultations and to hear the lung sounds of the patient. The gloves for the patient's uh, ma- uh, garments are here so that any particles that will come out to his nose or mouth will be absorbed by this cloth. And then while suctioning, we must protect ourselves, our noses, the particles that is we can see or we can prevent to transmit in our face or in our body. And also the suction catheter, which is the first, uh, the main equipment or materials needed in the suction. Also the pulse oximeter to monitor the vitals or the auto saturation of the patient. Kidney basin, the normal saline solution or the NSS. And I do not have here the water soluble for the suction catheter, but water soluble is applied to the suction catheter before we put it into the nostrils. Then after we prepare all the materials needed, we are going to go down to our patient, or we are already proceeding to our patient. And then if we are already prepare all the materials needed, uh, I will be going to my patient and so assuming that I am already in the patient's room, assuming also the patient is already in the semi-Fowler's position because I don't have any uh, uh, hospital bed available in our house, and then assuming that this is also my bedside table where all in my materials gathered and needed are here before the procedure. Okay, assuming that I will verify my patient. Are you Pamela? What is your name, ma'am?
Pamela Reyes.
And then you are the patients that need to be sanctioned
Yes.
as per the doctor's order. So after verifying the patient's name and verifying the patient's need, that is the physician's order, which is the suction. I will be washing my hand. I will have, assuming that I already washed my hands or I already done proper hand washing, I will be giving the uh, patient's privacy or the clients by closing the curtains or the doors or the windows and anything that can be the patient can be seen outside of the room. And then after hand washing, I will prepare all the materials needed. Assuming that my gloves is a sterile gloves because uh, I don't have available I don't my sterile gloves is not available. I only have the nitrile gloves. So here, so doing the if your NSS is already open or new, you need to pour it into the kidney basin so that the outer layer of the normal saline solution is, or the microorganism that stays on the NSS will be poured out. Now, we will put the pulse oximeter to monitor the patient's pulse ox. Assuming that the patient is already in the semi-Fowler's position. Now, assuming that this is undergarments that the patient may be covered is undershirt. Konti. And the stethoscope I will set aside because assuming that I already hear the lung sound of the patient, and as per the physician's order, it is already cleared and ready to sanction. So I will be for assuming that I already opened the sterile gloves. So I will be done gloving and step back into my working field, and don't put the hand below your waist level. So one, from sterile, step back out to the working field. Gloves. Sweet kasi ng gloves eh. So now after doing done my gloving, I will open the suction catheter. Now when opening the suction catheter, already open the suction catheter, using your dominant hand, which is my dominant hand is my right hand, it will be the sterile part or the sterile area. Once I hold the suction catheter, the other one will be the unsterile part in holding this one. Now, while using the catheter, I will be assuming that I already on the suction machine and it is already set in the 80 to 120 wall unit for the adults, and then assuming that I already attached the suction machine, the suction hose machine in my suction catheter, and I will be testing my suction catheter first. It's working. assuming that that is it is suctioning the water. Because we don't have available a suction machine. And then after doing this, we'll do it like this, so that we will maintain the sterility of the suction catheter. Because as I said earlier, is my dominant hand will be the sterile part, and my non-dominant hand will be the unsterile part. Now, before we suction, we will apply the water-soluble uh, lubricant, assuming that this is the water-soluble lubricant. And since the best part, or uh, the nearest part on the patient is the right nostrils, I will be doing the suctioning, or I will be inserting the suction catheter in her right nostrils. I will tilt the patient's up. One thing, it's a video. Yeah. So I am assuming that I will be inserting the suction catheter from 80 to 120 set wall unit. And then insert, and then 10 seconds, suction, then up, then place it to the right nostrils. Sorry. Then check for the patient's response. Explain to the patient the importance of the coughing while during the suctioning catheter, and while during the suction. And then after explaining this to the patient, the importance of the coughing, check the patient's pulse rate, okay. It should be normal, and then wait for another 2 minutes before you insert again the suction catheter. And look for the patient and ask the patient if it's okay. And ma'am, do you have any wheezes or cracklings or anything that is it might feel in your under your larynx or the pharynx?
Yes.
A little bit.
A little bit uncomfortable.
So the patient still has the feel there is something that we need to sanction it for our last time. Then again, apply the oops. Sorry po. Wala po kasing bedside. Wala kasi kami kamo, hospital. So again, after you clean it in the nasal NSS, apply again the Kelly water soluble lubricant, and then again for 10 seconds for the suction, 80 to 120 volt unit. Insert, rotation, and for 10 seconds, and in, out. Now just put it in the saline solution. And then ask the patient if he or she already comfortable. Am I already comfortable? Do you not feel injured in your nose or nostrils?
No.
Okay. So the patient's pulse rate is the 99 and 90. It is in the average or in the normal range. So after doing the sectioning, we might fold this like this. Remove our hand, and then disregard, assuming that there is a trash bag. Disregard, and then dispose this water. And dispose everything here. You might be wondering why I didn't use the face shield. Obviously, in the hospital protocol, you need to wear the face shield or any cover in your face so that the particles that comes out into the mouth of the patient or in the nose of the patient might be protect or you are protected. Like for example, the phlegm or anything that is comes out to the patient. But for this video, I did not use this board because you might not hear what I'm saying, and you might not clearly hear what I'm saying and discussing or explaining while doing the return demonstration. This one. So I'm already done doing the suctioning. Everything looks good, and then after all the suction the procedure done, record all the vital signs of the patient, and most importantly the one that we already get, or the specimen that we get through the suctioning come that comes from the patient, whether it's the color, the mucus, the stickiness, the thickness, and the odor of the uh, sample or the specimens. After that, record it and then document it and then report it to the physician. So that's all for the suctioning. Thank you.